This is William Munoz. I'm going to do Cat 3 SOT video. Okay. So first thing we're going to do is we're going to block Cat 3. What I want my patient to do is go face down for me. And initially we would check for the short leg. And what we're going to do is we're going to bring the legs out immediately. Ask the patient to push out and hold. Go ahead, push out. We're going to hold there for 3 seconds. We're going to look at the malleoli, superior malleoli as short legs. We got a short leg on the right side. And what we're going to do is we're going to take short leg, we're going to go to the trochanter. And here we're going to do passive blocking, go to trochanter. This is going to be 45 degrees inferiorly. We're going to go to the long leg side, and we're going to go 45 degrees inferiorly as well on the ASIS. And for this, all we're doing is to look to reduce the pain. And we're going to have the patient on there for up to 30 minutes. Goal is reduction of pain. Okay, so number 2 is the posterior iliofemoral ligament. And so we're going to have the patient blocked. And what we want to do is... Okay, we're going to go to the... out of the foot of the table, and we're going to rotate the patient's legs internal rotation, and we're looking for the one that provides the most resistance. So the long leg side has the most resistance. So we're going to go to the greater trochanter. We're going to go inch up and an inch posterior, and I'm going to use a thumb toggle, and I'm going to thumb toggle all the way across to the other acetabulum. And then again, we're going to come back and recheck and make sure that they're okay. Next on the list is augmentation for lumbar vertebral derotation. So on this, we would have the patient blocked again for Cat 3. And then let's say that we had a spinous process that was to the left and correlated to the cervical spine. What we're going to do is we're going to lift up the patient's leg. We're going to use our thumb contact on the lateral side of the spinous process, and we are going to push from lateral to medial for 5 seconds. So we're going to do that 3 times. And then we have lumbar inferiority lift. Again, we're going to find the inferiority, which correlates to the cervical spine. We're going to lift the affected side up. We're going to contact the mammillary process. And we're going to go I to S again. We're going to do 5-second pressure. We're going to do that 3 times. So acetabular goading. So we're going to go to both acetabulums. We're going to palpate around the acetabulum, looking for any kind of nodule. We do this little circular pattern. We find a nodule, we're going to press that nodule, and we can do this circular pattern, or we can rotate in and out. What we're trying to do is release that nodule. Orthopedic blocking, again, that has to do with spinous rotation, so that would correlate with the cervical spine indicators. So if I had a left rotated spinous, I would pull that block on that side and allow the patient to sit there for 3 to 5 minutes using gravity to pull the spinous back. Can't see that light is so bright. So this will be sciatic augmentation, and again the patient will be properly blocked. So we'll go ahead and set this one back up on the ASIS. And so the indicator is sciatic nerve. That's okay. And so if they had pain going down their sciatic, we would go ahead and traction that leg. So we'll say that the left side. So patient, can you hold on to the head of the table? And I'll go ahead and traction that side. We'll do it for up to 10 seconds until the pain decreases or it doesn't change at all. So post-blocking sacral cup. On this one, we are going to have the patient lift their leg up. Go ahead and lift your leg up, and I'll push down. If that goes weak, obviously we'll touch the other side. If this goes weak, and yeah, there'll be no blocks on this one. And if it goes weak, then we are going to palpate S1, lift the, well, in between S1 and S2, of the patient lift their leg. If that goes strong, then we'll go ahead and do a thumb toggle on the S1, S2. And again, we'll test the between the S3 and S4 as well. And that should correct, and we'll go back and recheck. That should correct. Sitting disc technique, we'll have my patient sit up and face the wall there. So we're going to find the affected area, spinous process, and we're going to put a two-thumb contact underneath it. I'm going to have my patient tuck their chin to their chest. I'm going to have you take a deep breath in, and then, actually, cancel that. So exhale, take a deep breath in. I want you to bend at the waist, or bend at the area. And I'm going to go I to S. When you exhale, I want you to return back to the position with your chin still tucked to your chest. I'm going to push P to A. We're going to do that again. Inhale. I'm going to push I to S. Then we're going to come back again. Exhale and back to center. That is that. We want to reduce pain there. So side posture technique. So we're going to have my patient on their side, and this is going to be if the patient has any sciatic pain or has a rotation to their left, spinous rotation left, or has an inferiority on the right. So I'm going to go ahead and take the patient's leg. I'll use their popliteal fossa. I'll put that where my knee is. I'll go ahead and compress the shoulder, providing some traction. Fingers up the spine. If it's an inferiority, I will go I to S. If it is a rotation, I will go P to A. And that is Cat 3.